Today's Monday Medical Minute is about a Jones fracture, which is a fracture involving your fifth metatarsal. I'm going to show you an x-ray of one of my patients with a Jones fracture. This is an AP view, and you can see the fracture line right in this area. Fifth metatarsal is here. Base of the fifth metatarsal is this location. And here is the fracture line going transversely at the junction of the metaphyseal region and the diaphysis. Remember, the metaphysis is a wider area shaped like an M. That's how you remember it. And the diaphysis is a more narrow area. How do you treat this fracture? Because there is poor blood supply to the area of the Jones fracture, which is right at the junction of the diaphysis and the metaphysis, you will make this patient non-weight bearing 6 to 8 weeks. Other metatarsal fractures, typically you make them weight bearing as tolerated in a cast boot. This fracture is different, so it's really important that you identify this fracture. In an elite or competitive athlete, you're going to want to go ahead and put an intrameduallary screw to fix that fracture, because there is a very high rate of refracture, about 33%, and non-union in elite or competitive athletes. Treatment is non-weight bearing 6 to 8 weeks. If you have an elite or competitive athlete, you'll definitely want to put an intramedullary screw. If you have a patient who just doesn't heal this fracture, you'll need most likely a bone grafting and an intramedullary screw.